You go like
Okay, sir.
the same is when you we have to start.
Yes, sir.
Sunil sir. Yes.
Got it. I'll go got it.
Sir, we are live now. Good to go, sir.
Okay. Good evening. On behalf of Sexual Medicine Committee Foxy, myself, Dr. Neeraj Jadhav, Chairperson of the Sexual Medicine Committee, along with Dr. Apurva Datta, my co-moderator, who is the National Coordinator for the Public Awareness of Sexual Medicine Committee, we welcome all of you. Welcome to the masterclass series S Blue Sexuality and Sexual Health. Since long time, we were toying with the idea of doing one series on sexual health. We did many webinars in the last 1.5 years with in so many states. We
हमने
come to
चालू
understand
करता
that our gynecologists are eager to learn about sexual medicine. They come across many patients with sexual problems in their day-to-day practice, but as medicine was never taught in our medical college, they are not confident to deal with such patients. So this whole series was thought. We wanted to take one topic at a time and give in-depth guidance how to evaluate and manage various sexual dysfunctions. In last 5 sessions, we covered major sexual dysfunction, that is HSDD, female orgasmic disorder, genitopelvic pain or penetration disorder, erectile dysfunction, and premature ejaculation. We are fortunate to have some best faculty from the field of sexual medicine as our masters who gave their valuable time to share their knowledge. मैं अकेला ही चला था जानी बे मंजिल मगर लोग साथ आते गए और कारवा बनता गया. After each session, along with the ICOG certificate, we also send reading and reference material along with the video recording link of the session to all the delegates. We got so many feedback after each session. We are happy that each session help you to master the subject of sexual medicine. In future also, we will continue to help our fellow gynec to enrich the subject of sexual health with more innovative and informative programs. Today, this is the last session of the series. So today we will cover three important aspects, that is history taking, counseling, and how to start sexual medicine clinic or practice. As a gynec, we are fortunate to have a rapport with our female patient. If we can start conversing with our patient about sexual problem, I am sure more and more patients will come out with their issue and we can help where many patients are suffering in silence. As sex is still considered taboo topic, they are hesitant to talk about their problem. But Sexual Medicine Committee is committed to make the difference. यही जज्बा रहा तो मुश्किलों का हल भी निकलेगा. जमी बंजर हुई तो क्या, वहीं से जल भी निकलेगा. न मायूस हो, न घबरा, अंधेरों से मेरे साथी, इन्हीं रातों के दामन से सुनहरा कल भी निकलेगा. So welcome once again to the deep sea of knowledge. Today we have one stalwart as a chief guest, Dr. P.K. Sasar. For all of us, we don't need his introduction. He is a very familiar figure for all of us. He was past president of Foxy, past secretary general of Foxy, and served as a president and other capacity in so many other organizations. So I welcome you, sir. Please bless us with your kind words. Dr. P.K. Sasar.
Yeah. Thank you, Neeraj. At the outset, let me thank you for inviting me as a chief guest for this masterclass series and the last session, number 6 of the same, the S Blue Sexuality and Sexual Health, Unraveling the Enigma Algorithm of Sexual Medicine. I am really impressed. First of all, I feel that in country like ours, where majority of us are conservative, people usually don't talk about sex and sexuality. So when we started this committee in Foxy, when I was an office bearer, we had fantastic chairpersons, including Neeraj, who have done fantastic job and excellent job of having various conferences and webinars. Let me tell you, as Neeraj said, that there is hesitancy on the part of the people to come out with sexual problems. So they are happy that we have webinars where they are not seen, but they can hear the experts in the field of sexual medicine. So I am very happy, Neeraj, as a chairperson of Sexual Medicine Committee of FOXY. You have done very good job, very sincere and hardworking, and I wish you all the very best for your future endeavors. Now, what is important is today's topic and the speakers. We have Dr. Rajshekar Brahmabhat, Dr. Vijay Sarthi Ramanathan, and our own Dr. Sunil Jindal. I am sure the two speakers, Dr. Raj and Dr. Vijay, at least I have not heard them earlier on. So I feel and consider myself very lucky that I'll be listening to them today, the experts in the field. And following this, we have the panel, which is going to be conducted by Dr. Neeraj Jadhav and Dr. Apurva Kumar Datta. I'm sure people will spend a fantastic evening learning about sexuality and sex. And what is important is that sexual medicine has become a very big subject now. And I hope that people come out with their problems in open and take proper opinion of the experts. Like when I was at KEM hospital and Dr. Raj talked about Dr. Prakash Kotari, who was a teacher when we were students at KEM hospital. We used to feel very odd when he would show us some videos and talk about the sex and sexuality. But I feel now a time has come when we should open up and talk about sexual problems and get the solutions for it. All the best to Neeraj for your all future endeavors, and thank you very much for having me here for this particular webinar. Thank you.
Thank you, sir.
Yeah.
Thank you for your kind words. Now I request Dr. Apurva to introduce our three masters for today's session. Please, Apurva.
Thank you so much, Neeraj sir. First of all, thank you so much, PK Shah sir. Sir is himself is an institution. We always get inspiration from you, sir. You are a great academician. Thank you for coming here and giving your precious time and blessing to this web series. Coming to our scientific session, we have three eminent speakers, faculty with us today. We have a very senior and very renowned Dr. Raj Brahmabhat sir. Everyone know him. Brahmabhat sir is a sexologist from Mumbai. He is a founder, secretary, trustee of CSEPI. Welcome, sir, and thank you so much for accepting our invitation. The second, we have our own Dr. Sunil Jindal, sir. Sir is a senior consultant, andrologist, reproductive medicine specialist working at Meerut. Thank you so much, sir, for always being here. Our next speaker is Dr. Vijay Sarthi sir from Sydney. He is a lecturer there at Westmead Medical School, Sydney from Australia. Thank you so much, sir, for accepting our invitation and giving your time and lecture here. Thank you, and I welcome to all of you. Now coming to our first lecture. For that, I want to welcome Dr. Raj Brahmabhat sir. Sir, the question to you, actually we always often, because as PK Shah sir already stated, that in nowhere in the medical colleges actually we were taught about the sexual medicine. So whenever a patient come to us, so first thing which we have in my mind, that what we should ask the patient about, what history is relevant for that, and history is not relevant what the that ask for our sexual medicine practice or for this type of patients who come for the sexual problem. Over to you, Raj Brahmavat, sir.
And will we start with the screen? Sure. Yes. Okay. Good evening, friends. Can you hear me, Neeraj?
We can hear you.
Yes, sir. Absolutely, sir.
At the onset, let me say the season's greeting to you. Bombay is raining from morning and it's a beautiful weather. And I'm much more happy when I can see Dr. P.K. Shah over here. Same person from Bombay, we are at two different ends and I'm sure he must be feeling the same, that is a beautiful rain coming outside. And we would like to extend our season's greetings to all of you. I'm extremely happy, particularly, that today in a gynecological society, that is POXI, I have been invited by Dr. Neeraj Jadhav and the complete team. I have been bothering them last couple of days and asking them various things, that what to say and what not to say. And he has been kind enough to take my phone immediately at any odd hours. Let me begin with my talk. And as before we talked, we had a foreplay for about 15 minutes. And in foreplay, what I was feeling, the same thing was echoed. In Indian Psychiatric Society 2004, it was a 56th annual conference. And I was invited to speak on a subject, and I was the only consultant in sexual medicine among 2000 psychiatrists. And I was about to speak on a sexuality yesterday, today, and tomorrow. Believe me, by 11 o'clock, I completed my talk, and in the evening, I was in a newspaper as a headline, called to bring sex out of the closet. Now, sex was an orphan subject. Nobody was ready to take it. And somehow the andrologists and urologists made it very mechanical, like a plumbing job. So I felt this is not correct. We need to work over it. And I said, the real sex organ is between 2 ears, not between the two legs. And I'm happy that in psychiatry, there are subspecialty like a child psychiatry, geriatric psychiatry, social psychiatry, rehab psychiatry, forensic psychiatry, military psychiatry. So I'm happy that they have taken it up this as one of the most important part and a subspecialty. As far as the gynec society is concerned, twice I had gone there, and my own teacher, Dr. Rawal, one of the great gynecologists, he had called me to my alma mater, that is Nayar, to give a talk, and he gave me 2 sessions to talk on sexuality more than 30 years back. And Dr. Mota Shah, one of the giant in the field of in the field of the gynec and obstetric. She, and once I was sharing the platform with Dr. Mahapatra from Cuttack. And they said that we gynecologists, we need this subject. And I'm today extremely happy that you have started a master series. I'll be trying to give you, as Neeraj and Dr. Arnav was saying, the history taking, which is the most important part. This is the basic. Nobody has taught us how to take a history. During my days, Hutchison's clinical method was there. The first edition was in 1897, and about 10, 12 years when I looked into it, the same Hutchison which described the stool and urine, what is the color, what is the consistency, what is the smell, whether the food particles are there, whether the blood is there, whether any other foreign particle. Same, there was hardly question on sexual medicine. So you can imagine, the eyes does not see what the mind does not know. And that's why history taking is a very, very important part of the sexual dysfunction. I'm going to talk totally basic, what I have learned in last 40 years from my own practice by trial and error methods. And particularly in an Indian scenario, in a busy OPD or in a busy gynec ward, how you can do it, Now the question is it an art or a science? And I say it borrows from both of them. You'll have to be like a Sherlock Holmes just to identify where is the problem and how is the problem. Now, being a gynecologist, I have seen many of my friends busy OPD. Hardly there is a time. There are some people who have got 3 cubicles. One, they have examined the patient, they go to the second, and then they go to the third. And particularly in the hospital setup, it's a very, very busy OPD. So for you, you will think that whether it is good to be a consultant in a sexual medicine, is it good to know one more part about it? Let me tell you honestly, the same problem 40 years back when I was doing a general practice, I was like a Hamlet, to be or not to be. And today I can tell you I'm an extremely happy person. If you do this, you will get name, fame, and money. And the most important part, treating those patients, who have been suffering silently, which I call them a silent bleeder, and you'll be able to help them out. Friends, this was a book I had edited in 1998. This is the first of its type book in the SAARC country. I had invited sexual people working in sexual medicine, andrologists, urologists, psychiatrists, from the HIV/AIDS people, and the psychologists. What I saw that when I started a practice, those were the days, those were not the days like today, where you are very lucky that with Google, anything you can get it within a minute. Even to keep a small paper on sex was considered as a pornographic. And those who knew little bit, they were not ready to share it. So my first job was that let it go to the number of people. And today I say 1,000 and 1,000 of you take it up this particular branch as one of their, a practicing and interesting subject. I can tell you still we need many more people over here. We were under the British rule for more than 200 years. So in Britain, it's a Victorian era. No sex, please. Even if the female has to be examined, she has to be examined with a doll, and they have to show that where the problem is. So today, I'm going to unveil the veil, and I'm going to open up a Pandora's box. How you can tackle the female sexual dysfunctions in your busy practice. Female were considered as a frigid and sexually unresponsive. They were considered as a doormat. In today's words, if I say they were the baby producing machine like any washing machine, they thought that she does not have her own ideas about the sexuality. It was a male dominating area. After the First and Second World War, what happened? That there were a lot of men who died. So they had to come out from their home. They stepped out of their closet, and they started working in a factory, in an office. And they started cutting the hairs, and they started being equal with the men. Today, you look around and you will find more number of CEOs in the top countries are the female than the male. So it is wrong to say. And if you see any of the medical book, which were written before 1970, for a man, the word which was used for all the sexual dysfunction is impotency. And in case of a female, frigidity, which is not correct. Now, today's women are entirely different. There is an economic independence. Media, you take up any glossy magazine and you will find there is one article on a female magazine on sexuality. Permissive sexual attitude, availability of the contraceptives, and easy legal abortion and morning after pill. And today we see they are working in a call center, IT industries, and even in a living relationship. Today, premarital sex is no more a taboo. I can see many women, they coming out and they talking not to me, but their own partner about their past. They are more honest, not a hypocrite like us. Our whole generation was hypocrite. They are very honest what they want to do it, and about their sexuality, it's not a big deal. I can tell you very interesting case which I had last month. A young boy who felt that he could not perform and he was having an erectile dysfunction. He went to the Google, came for the treatment with me, and when I said, I need your partner to talk, he said, I'm unmarried, but she has come from abroad and we met in a hotel, and once at my place, both the time I have failed. I said, but I need to talk to her. To my surprise, he talked to the father, and his father, being a Marwadi person, he said, and a very orthodox person, he said, Dr. Saab, लड़की में कुछ गलती नहीं है, मेरे बेटे में है. I said, how do you know? He said, मैंने लड़की से बात किया. She had 2 or 3 sexual relation in foreign countries. So it's a problem with her. So this is the whole scenario. The pendulum has changed. And today, if I see my first 100 cases, only 5 women accompanied the man. Out of them, 3 had a vaginismus and 2 had dyspareunia. Today, they find it out my name from the directory or from anywhere. They will call up in the afternoon. They will bring their husband. They want to reach an orgasm. They want to have a very healthy sex life. So today the scenario has changed. Thanks to Masters and Johnson, their record and the path-breaking studies of human sexual response and human sexual inadequacy. One telling us about the physiology and giving us a detail, and the second telling us about varieties types of the problems which are there. And today we can pinpoint where is the problem rather than using a single word like impotency or frigidity. This is a very, very interesting graph, and all of you have studied. The desire part was put by Helen Kaplan. They had missed earlier. So desire, excitement, orgasm, and resolution in case of a male. Well, in case of a female, you can find that there are 3 varieties of the different types of sexual response. One is a usual desire, excitement, orgasm, and comes back to the resolution. The other, there is a multiple orgasm. So female are much more powerful than the men. And third one, which you see in your practice much more, they never reach an orgasm. It remains for a long time. Resolution takes a very long period. These are the women who come with the white discharge, backache, irritability. So this particular thing, if you keep it in the mind, you can have the problem in the desire phase, arousal phase, orgasm phase, and in the pain and other things. This is a very, in case of a female, all of those who are interested in doing more studies, there's a newer concept or newer human sexual response for the female has come up by Bess and Rosemary in 2001. And it talks much more that in case of a female, it is not that switch on and switch off. Her sexuality is entirely different. And emotion is a very, very important part. This is one word which I'll be talking all throughout my talk. Now, in case of a woman, there can be hypoactive sexual desire disorder, sexual aversion, arousal disorder, inhibited female orgasm. And the maximum you will come is a dyspareunia and vaginismus. Vaginismus is the quite commonest problem as far as the female are concerned. Now, what they have not discussed is the common sexual myths. These are the myths which are carried from one generation to another because there is no sexuality education is given. If it is given, which is very patchy and which is not a sexuality education, which I'll be talking about it. So what are those problems? Masturbation. So female, when I was taking my first talk when I was doing in 1980, presenting the paper, believe me, I must have asked 40 women that do you masturbate? Then answer was no. Only one female doctor, she said, one of my patients she has admitted. So it was a great taboo, and one can talk for hours and hours on the masturbation. Our religious, political people, they all have condemned it. And not only here, even in USA, when the Kinsey's study came out, they say here is a person who is a spy, who is a Russian man, and he's trying to corrupt our American population. Fertility, you have been dealing day in and day out, common sexual myths around it. Vaginal secretion, either it is a physiological, or as I said, that they have not reached an orgasm, or it can be sometimes due to infection. Now, these are the people when they come to client with, they come to you, you have to give, and there you can ask their sexual life. G-spot. About 10 years back, one girl came all the way from Lucknow to find her G-spot. And today you will be finding more and more such people who wants to reach an orgasm and have to find about the expectation of sex act. After reading in the novel or reading in for example, Harold Robbins, one of my South Indian patient, she was reading the complete description. He was a blue-eyed man with a triangular, body and six-pack, and he was wearing a jeans. And the moment he removed the zip, when he sprung like a lion. And when she saw on the first night, she just told that boy that "Tumhara to chuhe ke jaisa," like a mouse. Believe me, he got such a serious problem that he could not get erection for a long time. And she believed that book. Ultimately, I had to call her father and tell him that just kindly explain what she has read is a fantasy, it's not a reality. What they see, the penis working for 45 minutes in a blue film, they think this is what it is. But no, these are all wrong things which are being done over a 6 months or 6 years, and they have been joined together. Penile size anxiety. About the size of the penis, they are worried, either big or small. They have never seen an erect penis in their life, and when they see, they feel terribly worried because some friends or their sisters have told कि बहुत ही bleeding होगा, बहुत ही pain होगा, and she's worried. And the other way around, there was one auntie told the next door neighbor that you have got a very small apparatus. He could not marry for 22 years. So that is another problem. Breast size, right from our ancient time, if you see our sculptures, paintings, our mythology, or even advertisement today, they have given a lot of importance to the breast size. And that's why the women who have they have their own problem, self-esteem problem or body problem, that their body is not okay. They are not normal. Thanks to Bollywood. Right now, there are 2 or 3 heroines which are absolutely flat-chested, like an American, Hollywood, and they are being respected because of their acting. Homosexuality, I'll be talking to it in a detail. Orgasm, and I have put ... The older myths are dying and newer myths are coming. Myths are like a phoenix bird. What happens? That like a phoenix bird, when it burns itself, after 200 years, a new myth comes up over here. Now, why you cannot do? You have to have a very open communication with your client. You feel that you will embarrass the patient, and that's why you did not want to talk about it. You are unclear what to do with the answer. But now I'm sure with the master series, the way in which I have been reading about it, you will not have this problem. Fear of sexual misconduct charges. Yes, you have to be very, very careful. Somebody said that because we are close to the female and we can talk to them. Yes, talk to them, but not in an examination room. Bring them outside in your cabin. And that is the time you can talk to them and how we should open the discussion that I'll tell you in a minute. And not trained in treating this area, you cannot say now. I have been conducting a lot of workshops. It's like doing an endoscopy. You read about it, see the video, you can't do it. You will have to have an hand-on experience. So in a workshop, we conduct how to talk, and the major important part is how to take a sexual history. We are in a HIV/AIDS era, and sexual health, like a physical health, mental health, financial health, spiritual health, it's a very important health. And not only one, both the people. So it's a requirement of a quality of life. How long you lived, it is not important, but how beautifully and what quality you live, this is the more important. Now, this is one slide I would like to take home. Biopsychosocial. We have been dealing with corona right now. Just take a test and the diagnosis is in your hand. There are certain cases where you have to have a psychological problem. But here the social problem, which is a major problem, it affects the both of them. So you will have to keep this particular model in your mind while treating the clients or the patient which you are seeing. Now, common sexual difficulties are very little foreplay. My teacher used to say, man is like a light. The moment you switch on, the light is there. And the female is like a istri, that is iron. It takes a time to become hot. So you cannot have a little foreplay. And many women, the most important part, they complain, my husband is not romantic. He just comes, he wants me to give a service in the bed. And at the end of it, she feels that I am dry, I have not enjoyed anything. And next time it becomes one more burden, one more work to me. Frequency. Again, there is a lot of discrepancy between the frequency of what one person wants and what another person wants. So there are adjustment problems as far as the frequency is concerned. Now, most important part is a relationship problem. Never say that this is a male problem or a female problem. Say that I'm treating you as an unit. In a factory or say a drug company, the losses are there, and one particular drug is not working. Either they have not marketed it properly, They have marketed, but then it has not been produced in the factory. They have produced, marketed, and it has not reached to the people. And last but not least, the finance people have not collected the money. So it's a problem of the whole unit. So what we are treating is not a male problem or not a female problem. We are treating the relationship, and relationship is the most important part as far as the sexual problems are concerned. Now, restrictive upbringing. I had one girl, she was from one of the top person, minister's daughter. She was brought up in a very restrictive upbringings, and they had a unconsummation of marriage for more than 4.5 years. And boy was very supportive. When they came to me, when I put them on what I call a sunset focus, I have converted into sex therapy or a talk therapy or a touch therapy or a couple therapy into sex exercise. I have made an Indian version. So that restrictive upbringing which was there, believe me, when I told her to take a bath, if she was not ready to take a bath with her husband, when I told her to take a bath herself, she cried. She said, I had never seen my nude body in my life. Now, that is a type. And traumatic early sexual experiences. Dr. Pikesa will know that this is the scene of a Mahalakshmi rocks, So many couples in Bombay, the major problem is the space problem. They cannot get where to go for the enjoyment, and particularly young couple. And I had suggested, like Dada Dadi Park, there should be a boy and a girl park where a people after the 18 years they can go, or the married people can, or a man and a woman park where they can go and enjoy themselves. Because sexual health, like health is a subject of state. So like any other health, this is a very important subject, and they should provide like a clean water, clean food, clean light, clean road. This is a requirement. So they were there enjoying themselves. They were about to get married after a month or two. And the boy was interested. He said, let's sit for a little longer, and it became dark. And 4 people suddenly appeared there. They torn her clothes. They raped her in front of him. He was shouting, but he could not do anything. He came out, got a taxi. At 9:15, 9:30 in the evening, there is not a single place, the store was available. He went to relative's place, took a cloth and gave her. That part was solved. But after marriage, she could not enjoy the sex. It was a very traumatic experience. So this question, you must always keep it in the mind. And after the treatment, he came that she, practically her whole chadar or the bed sheet was wet, that much, copious, the vaginal fluid came out. So this traumatic experience. There was another air hostess who was sexually abused by uncle. Her father was a drunkard. He was an alcoholic. And when he told the mother said, no, you don't say anything about the uncle. And she carried it, and it came up as a very big sexual problem. So even if it is in the childhood, 3 years or 4 years, if sexual abuse or physical abuse has occurred, keep it in the mind, and it's a very, very important part to treat. This is a very interesting study which was done by female sexual dysfunction, 43% among the American women compared to 31 American men. So you can imagine that this is much more, but they never came out in the surface. And 1 in 10 women who has a female sexual dysfunction seek help for the problem. So 9 women, they left without that. So it is a duty of you, me, and everybody in the field who are interested in sexual medicine, because if we have not given, that's why you see in your city, there are boards which are lying there, quacks board. Their advertisement runs in lakhs of rupees. And our gullible, patients at the population is being suffering because of that. So we are responsible. So we have to start working, and don't wait for the government. Don't wait for the medical college to start. You start at your own level. As Neeraj has said earlier, that हम अकेले ही चले थे जानिबे मंजिल की ओर, लोग मिलते गए और कारवा बनता गया. Today same thing happened, that in 1980 we few 4 or 5 people started, and today I'm seeing that it is growing all around the India. So you have to pick up a signal. There are signals like a childhood, puberty, sex education, about masturbation, sexual orientation, first experience, marriage, pregnancy, and abortion, which you deal, infertility, menopause, illness, drugs, and operation. So they enter in your clinic with a vague complaint, with a proper understanding. If you can't treat them, think that they have any sexual problem, and then you ask those questions. So the most important part is you will have to be comfortable with your own self. When you are talking, get how was your period, whether it was more or less, how many tampon you had to use it, or how many times, days it was there, whether you got a cramps, whether it got relieved with the tablet, before menstruation you got a pain. In the same breath, ask them about their sexual life. And that also how to ask, I'll tell you. There are female sexual function index and female sexual distress scales are there. I have never used. I'll never ask you to use any of those questionnaires. In our country, we are multilinguals. People won't understand and they won't be comfortable. But when you're talking them one-to-one, you will see their body language and which will be very helpful. Most important part. This is a very important thing which you should remember. There is no such thing as an uninvolved partner. It's a two people. In a cricket, a batsman, he hits the ball, it goes near the boundary, he runs from here, the runner doesn't run, and then he's out. But they have decided on the fourth ball or fifth ball, we will run and we will take, the ball can be near the crease. He runs. By the time the bowler or the wicket keeper takes, they have taken a run. So there is nothing like an uninvolved partner. And when you will find that other partners talk, and it's a difficult in your case, that how to bring a male, because I have seen all females sitting over there. So make a special day or call them before the practice. Or if they are not coming today, last 1 year and 3 months, I have been doing online on the phone only. So you can talk to the person concerned. Now, how you should ask? Do you have pain when you urinate? Do you notice any blood in your urine? Or ask about that, when was your last menstrual period? In the same breath, you say, is it okay if I ask you some question about your sexual function or your sexual life? And then you'll be seeing. Now, what points you should keep in the mind? First thing, you have to have a confidentiality. The first sentence I say to my clients, whatever you talk and I talk is going to be confidential. It will not go to your partner. It will not go to the referring authority, or it will not go to government or any other people. That is the most important part. Privacy. When you are talking, there should not be anybody alone. And if your assistant is there, tell them that, is it okay if the assistant sits over here or the nurse is sitting over there? Security. Keep all the notes. Either you write it in a way that nobody can read it. It is in a coded language, or you put it in your drawer. Ask patient permission. Is it okay if I talk to you about the sex? Initiate the talk. Techniques and language. Now, this is very important. They may use kamzori hoti hai. आजकल बातचीत नहीं होती. You may think that she's not talking with the husband, but बातचीत नहीं होती means they are not able to have sex. And particularly those who are coming from the north, it's very difficult to get a history from there. So do not use vernacular language. If they're educated, use 3 words that I have to use. These are my words and vocabulary: penis, vagina, intercourse, and breast. Or you say I have to use a word like ling, yoni, sambhog, or sun, and then it is fine. The open and close and question, I think somebody is doing the counseling, so I will not be stepping on that. Begin with a non-threatening question. Develop that trust, develop that bridge, and then you can enter into their private life. Be non-judgmental. If she is having relation with 5 people, it is her lookout the moment she is above 18. What you can tell that whenever you have a relation, whoever it may be, see that you protect yourself from STDs and from pregnancy and use a condom. These are the things, and without showing even a disinterest on your face, you have to be totally non-judgmental. Explanation. As I said, that they may use the word like kamzori hoti hai. So kamzori means what? Or baatchit nahi hoti hai. So ask them explanation whenever they say. Then feelings. The most important part for a female is, what do you feel? And she may feel that I'm being used. I'm not interested in it anymore. There is always another day. So I have a friend, Dr. Giresh Dani, and his son Saurabh Dani. They are practicing in a Kandivali area, Ankur Nursing Home. He has put a board, after my permission. So you can put some board, or you can say that if you have a sexual problem, they can talk to you after learning this. And whenever he can tackle, he will tackle. Otherwise, he'll pass on. So learn when to pass on. And the most important part is the time, and time. So you should have a knowledgeable head on your shoulder, and a time. If you do that, you'll be helping out many clients which are there. During first visit, you must ask about the marital status. Is she married? They are staying together. They are separate. They are divorced. They are about to get divorced. Or she's a widower. Living arrangement. How they are, I'll be talking to it in a minute, And there are many people right now, they have a live-in life. And what are the previous efforts to resolve the sexual problem? Now, diagnostic workup, medical history, which all of you know, onset, duration, and progress. If onset is sudden, think that it is by and large psychological. Unless they have started some medications and after that, or after some operation which are in the brain, spinal cord, or in the pelvic region, or some trauma. Otherwise, by and large, and four things you must remember in a medical history. Most important is a psychosocial history, and then sexual history, which I'll be talking to in a minute. Male, you take a separate, female history, you take a separate, and a combined history. Don't say that you come first or you come. Tell them that out of you two, first let them present the case to you. Say that out of you two, I would like to talk to one person at a time. And when you talk to one person, tell the other person. You don't decide. That other person will also get an equal time. Don't think that the person who enters the first, I am going to believe he or she. And during combine, never divulge the secret. Man may say that I'm not able to perform with my wife, but I'm able to perform with my partner outside. So don't say that he's not having erectile dysfunction. Or he may say other way around, that I'm not able to perform with partner outside, but with my wife, I'm able to perform it. Physical examination, laboratory tests, which are not a part of my talk today. In a medical history, couple of things you must remember is a depression, thyroid dysfunctions, cardiovascular diseases, and these are the very, very important question you must ask to each and everybody. And diabetes. Operation, as I said, in a brain area or in the spinal cord or in the pelvic region. Particularly many women after tubectomy or after hysterectomy, they think that it is, or after the menopause, they think that is end of their sex life. No. And always ask them what medications you are taking. Don't listen to the name. Ask them to bring to your clinic. And when you see, you'll be surprised that they are taking three medication which are not required. Even an ordinary there are many medications which can give a problem in the sexual desire and orgasm. They can become anorgasmic, particularly all those antidepressants. Even an ordinary cough syrup or antihistaminic can give rise to a sexual problem. So medical history, you have to take those, as I said, diabetes, depression, thyroid, cardiovascular system, operations, drugs. As far as psychiatry is concerned, just find it out. Say, I don't want to know, but do you have any anxiety or do you feel depressed about anything? What you are feeling? Or do you have any stress? I don't want to know it. But if you have, yes, then you clinch to a diagnosis that it has got a psychological problem also. Then send it to your psychiatrist friend and let them say it's an anxiety, depression, OCD, hysteria, or schizophrenia. It is their domain. Now, the most important part is a social history. And in social history, privacy is a big problem in a city like Bombay. Can you imagine people who are on the footpath, what sex life they have? Or in a joint family, I have one of the doctors sent me his compounder, and when I went into the detail, he could not perform after the marriage. And what was happening in a 10 by 12 room, there was just a curtain in between, a temporary curtain. One side, father, mother, and sister of a marriageable age was there. In other side, there was a cot. On the upper part of the cot, elder brother and his wife, and below the cot, the younger brother and his wife. What sort of a sex life they have got? So it's a very, very painful. Or many a time, the youngest couple has been asked to sleep in a drawing room where there is no bathroom attached. There's only one TV, so people are there up to 12 o'clock watching it. Early morning, she has to get up to take a milk person comes. So there's no time for them to enjoy their sex. So the privacy is a very big problem as far as the city is concerned. Now, urbanization and industrialization and commuting. Dr. P.K. Shah will agree that people is working at, say, one and Kolaba, and he's staying in Vasai Virarin, and he has to go in such a crowded train. How much strength he will have to have a sex? These are the problems which needs to be addressed. So you can tell them that either on Saturday, Sunday, you make it a thing, or you say that the first thing in the morning, when you get up, you're fresh, you try to do. So social and economical history is a very, very important part of the sex. Today, all of us are suffering because of the digital, the boom which has come up. We are spending more time with mobile phones, SMS, MMS, internet, and other things than our own partner. So the first thing you have to ask them that throw away everything from your bedroom. The moment you bedroom, there should not be any of these gadgets and no social media. I remember there was a one man who got up from the bed and he had a fever. And when he went to the washroom, the wife messaged, "How are you?" When he came out, he said, "I was all the time with you in the night. You need ask." He said, "No, the morning, first thing you see is take a mobile phone and go to the washroom." So this is our life, which has created many problems. Now, sexual dysfunction, clients and partners, sexual dysfunction, response cycle and motivation you to see. Now, in sexual history, libido, how much is the desire for sex? Arousal. If the desire is there, whether she gets aroused and she gets a lubrication. Penetration. And while penetration, is there any pain? Does she reaches an orgasm? Now, if you see in case of a female, all of them can be hidden. Whether she has the desire or not, she can always say that I have a desire because she has to make her husband happy. Lubrication, because she is lying down, you cannot see the lubrication unless you feel. And orgasm, as far as the orgasm is concerned, she can always fake an orgasm. Unlike the male, the erection can be seen, ejaculation can be seen. So that's why there are more focus on the male sexual problem than in female. Apart from that, dyspareunia, the pain, it can be superficial and deep, and which you have been dealing. And many a time before entering, if the pain is there, think that it is a psychogenic and there is some relationship problem. Current partner. What is the current partner? Coital history. Tell that, exactly tell me what happens once you close your bedroom and you are in the bed. Whether the lights are on, lights are off, who initiate, how much is the foreplay, how much is the afterplay and other things. History of masturbation is very important. Now female are open to talk. History of homosexuality and fantasy, and ask them that whether are you watching some porn, and to your surprise, 8 out of 10 women are regularly watching the porn, and when they are meeting their friend, they are discussing about it. Sexuality education, what was given to them at school before marriage and other things. And as I said, how much is the effect of porn in their life? Religious and sex plays a very, very important role. During Shravan months or during some fasting season, they do not allow the husband to touch, and that creates a very wide gap. And I had a Marwadi, again a businessman, and he used to get mad during the Shravan month. His wife used to follow, she used to sleep in another room, and he was feeling restless. There is another woman who came from Pendi Bazaar, one of the Muslim dominating area. And I was telling them about my sex exercise and treating them on a sex therapy. She won't go further. And I said, why? She said, in the first early morning namaz, when I pray, I have to be very clean. So last night I had no sexual relation. The moment I take a bath, it was a joint family, my sister-in-law and everybody will come to know. Now I said, you give me a time to think. It's a very important part of religion. And then I came into the studies and I said, you can do one thing. What you can do, that you tell your sister-in-law that I'm going to take bath every day, irrespective of whatever may be the season. And then nobody will doubt it. I'm treating right now somebody from Banaras, and he said, for 10 days, I won't be able to do anything. I said, why? He's a Pandit. He said, I'm doing some puja, and during that time, I have to be very clean. So religion plays a very important part. Incest and rape, I have said, already talked about them. Sexual orientation. This is a very, very important subject. And from Neeraj, from your place, Rajkot, there were a girl who got married to Bombay, and she was not interested in sex. Now, what happened during adolescent phase, during puberty, there's a transient homosexuality. Person likes to be with the same sex. It's a transient, but then they go back and they go back to their heterosexuality. Now, these are the people who needs, and now more and more girls are coming out openly and talking about their sexual orientations. Marriage, it is glorified in our country like anything. Our whole life is on the marriage and the first night failure. Believe me, 30% of the client comes from the first night failures. And the virginity is a big issue. So many women now goes to a cosmetology to do the hymenoplasty. And first night failure, as I showed you in my first book, I have written a complete chapter and more than 33 causes I have given. And from this particular, they come down immediately after the honeymoon without doing anything. So first night, it is never seen in a Western country on Western literature. So what they call it sometimes honeymoon blues, but not in this. And the first person they visit is a gynecologist because they have been brought up with that way. And unfortunately, in the olden days, the first thing was done thinking that something problem is there, so do an hymenectomy. I had a young girl when I was doing general practice and I was just entering into the sexual medicine. I knew the family. I attended the marriage, posh marriage. Then on the third day, the father and mother came and I asked, "What is up? How are you? Beti kaisi hai?" They started crying. Then the wife developed some, he says, "Ghar pe aa gayi." And I thought, okay, normally after marriage, they come home. No, they said forever they have, what had happened first night, the boy could not perform. He told his uncle, he was taken to a gynecologist and they said, "Tumhari theli," means uterus is small now. It has nothing to do with sex. I took a phone number. I just talked to them, gave them a little bit of sex education. About 3-4 years at Sasam conference, I was at the Bangalore airport. He came running from a distance. He said, "Uncle, you remember me with 2 kids?" And then he said, "Touch the feet." And they said, "Aapne humko zero se hero bana diya." So this is what change you can do it. So first night is a very important and there are many problems around it. Another area, you feel that it is not important what doctor is talking rather than talking some neurotransmitters or some PD5 inhibitor or some other drugs. This is a very, very important. Somebody's teeth is smelling, they are dark with the pan, chewing the pan, or with the katta, or with the tobacco, they are smelling badly. They have not shampooed themselves. They are not changing their underwears regularly. And there are sometimes the dandruff is there. The small, small things puts turns off the other partner in a big way. The other major factor you must inquire that who else are staying along with you. And this Saas Bhi Kabhi Bahoti, it runs for ages together because there is a power struggle which occurs and man gets crushed from both the sides. And particularly in Saas Bhi Kabhi Bahoti, if there is a one son, the problem is much more. And if she's a widower, still the problems are much more. Because men's attention gets divided. One side, one lady has taken care of 22 years and the other lady comes in his life. And within 22 hours, she says, whatever you have learned is wrong. So this is a very important part. As I said, 14-day syndrome, as you all know, it is a iatrogenic problem. You do a ovulation studies, you tell them that on particular day, or so many times you ask them, just go and do the semen examination. If you want to do it, call that man, say that I'm privately asking you to do a semen examination. We'll take 3 reports. Don't tell anybody in the house. You come and report to me directly. If 3 reports, if there is something wrong, it can be always corrected. But the moment they say the 14 day, because nowadays, marriage age has gone up. Once which was there, 18, 19, 20, today it has gone to 25 to 30 or 32 because they want to reach somewhere height in their career. And suddenly after first 2 years, nobody says, but after that they say, you will have to have a baby. And on that day, from the morning, she says that, I have ovulated, come home early. And from that time, the man starts getting tension and is not able to perform. And then there is a lot of marital disharmony which is occurring. What we are treating in sexual medicine is relationship, relationship, and relationship. It is not the man or a woman. It is how they communicate, not in the bedroom, but outside bedroom. It is the time, trust, touch, talk, and togetherness. These 5 mantras, if you keep it in your mind, try to see that how much of them they have been doing it, then it is wonderful. Extramarital relationships are increasing. Divorces are on increasing, about to get divorced, and people come to you. Now, I will give you in the end very simple formula. Keep it in the mind. Ask them 5 questions. How much is the desire for sex? Whether the lubrication you are getting it or not. If she's not getting, is she on any drugs or there is not enough of the foreplay? Ask them that, do you find any penetration problems and what position? And many people, they do not know the position. So you should keep some Xerox copies or maybe some wooden this thing available, dolls available, and show them that this is the way it. Never try to ask them to have sex in front of you. It is morally, ethically, and legally wrong, I say. There are some people who believes in it, but even two blind people were there, and I have treated them without touching them. So it's a very important that part. Lastly, do they reach an orgasm? They read in the newspaper, they read in the some novel, and some friends, they think that it is, like a big tamasha and they enjoy, and it's not happening. It can be, it differs from a person to person. Dyspareunia, which you know much better than what I can teach you. Now, I ask them a very simple scale. To a female, I ask that last 10 sexual encounter you see. Out of 10, it may be in 1 month, 2 months, 3 months. How many times you have reached and what is your satisfaction? And that will give them, okay, this is the, it's arbitrary, but they will actually tell you what they are feeling. Friends, I have told you how to take a sexual history. The important part is a history, examination, and investigation. And so many times people ask me, what is the most important part? I would say first is, and the foremost most important part is a history taking. Second is a history taking, and the third is history taking. Spend good amount of time. Patient will give you what they are suffering, and they will give you the diagnosis. Any amount, and as I said, you have to be very comfortable yourself, make the client comfortable, and you act like a Sherlock Holmes. And as I said, non-threatening question first and then ask, and never try to be judgmental over there. I tell you, friends, around your society, you see they are the silent bleeder. In a house, if a child gets 102 temperature, the whole house gets disturbed. In a neighborhood, somebody while cutting the vegetables gets a blood, the whole neighborhood comes to there. On the road, somebody unconscious lying, people will come to help them. But these are the silent bleeders. They come, they move in the society, they go to the mall, they go to the party. Nobody is there to listen their cry. It is you, and if we do not do, we medical people, then the quacks which are suffering, they are going, quacks which are flourishing, they are going to take care of this. So we need to establish, and this is what I have been working for last 40 years, that I want, it's not a sexologist, but it's a consultant in sexual medicine. It's a sexual medicine like any other branch. Many of you have been called to give us sexuality education. Don't use the word sex education. Sex is only genital education, contraceptives education, or you may talk something about, the hygiene care. Sex is a physical act, while sexuality is a dimension of a personality. We tell them what are the values. We just don't give them a condom and say that you go and enjoy. No, if you feel that you are able to enjoy the sex, then you should be able to understand and take a responsibility of it. And lastly, you can start a premarital counseling, friends. Just put a board outside. Put 1 day in a week, and they will come to you. Just give them a little, or anybody comes to you with a wedding card, say that, well, my son, I'm very happy, or my daughter, I'm happy that you're getting married. When I got married, I had no knowledge. But if you want some question, both of you can come, and they will remain you forever. So friends, in the end, this is a very important part. Men conceptualize their sexuality in terms of a genital response. Man is ready to have sex anytime, every time, if his interested partner is there. While women conceptualize their sexuality in terms of relationship. And I was traveling about 4 years back. I had gone to Canadian Rockies. And while coming back at one place, no, it was in Japan. And we were coming back, from one place. And it was a 6-hour journey, 3 hours going and 3 hours coming. So they asked me, Doctor, would you like to talk about sexuality and sex? So I continued. I said, let me start talking to you about it. And when I talked to them, at the end, I said, I want to ask the question. There were 15 women. I said, can you tell me what is one thing you want from your husband? Nobody said that I want a fancy clothes, or I want to go to the resort or anything. What they want said, we need a respect from our husband. And that is the most important part. And friends, before we end, let me tell you that I was so lucky. I've been conducting a lot of workshops. I said, by reading about the laparoscopy, you can't learn. It is a hand-on practice. So Solapur, I was given an oration award. There I met Dr. Parag Patil. And he is a bridge between you, sexuality, and the gynec and obstetric. I have lost him, one of the COVID fighter he was. And Pune, BJ Medical College and Sasun Hospital, 29th February and 1st March 2020. I conducted 18 hours workshop for 48 postgraduate students and 6 teachers. And I tell you, many of them have started working in it. So what you need is an hand-on. Lastly, I'll tell you in one line, be comfortable, make your client comfortable, find out a time when you can discuss with them. If it is sudden, by and large, it is psychogenic. If it is gradual, there can be any problems of the disease or maybe due to some endocrine problem or relationship problem. Apart from that, 5 questions which I showed you, if you ask them properly, the diagnosis in your hand. The first paper which I presented in 1918, the first conference, was on Kama Sutra, ancient yet modern. Let me tell you, I must have talked about Kama Sutra 10 times, and every time I find we are the country who has shown the world what is sex and sexuality. We have given a scientific manual. Let's not run away from it. And you are the best people. And I have seen the Foxy organization, wonderful organization. You can take up this. And if you start spending at least 5 minutes every day, I am sure you will be able to do it after this master series. Let me tell you, I'm working at Nanavati Super Speciality. My number is here and you can get it from Neeraj. Any problem you have and anybody wants to learn anything about it, I have taken it up this as my mission. Because as I started, I was ridiculed not only by medical fraternity, but my own family member. कोई धंधा दूसरा नहीं मिला तो आज इधर जाते हो, and today I am happy that I have been invited. And this 40 years, what gives me a satisfaction is wonderful. Thank you once again to Foxy for giving me such an opportunity to meet a large audience. Thank you very much.
Thank you very much, sir. It was a beautiful listening to you about the history taking part in the sexual
I was,
medicine.
Dr. Shah, I was worried because I was told that you must deliver in the time. Otherwise, Nirav and Apurva are there, they will put a suction and throw the speaker out. So all the time you have spoken little fast because I wanted to deliver in 45 minutes.
It was a little bit past the time, but we didn't want to end this because it is a very important part of the total sexual medicine, how to take history, and we want to know each and every gynecologist should be familiar with the history taking part. And so you explained it beautifully, and it was wonderful to hear from you. Thank you very much, sir.
Thank you.
So from after history taking, now we come to the when we have diagnosed the patient having any sexual dysfunction, we want to counsel such patients. So for that, I invite Dr. Vijay Sarthi Ramanathan to teach us about the counseling part in the sexual medicine. Over to you, Dr. Vijay.
Thank you, Dr. Javel. Before doing that, can I show something, the proforma, the sexual history proforma that I use? I think it will be of use to the audience. So let me start with that. 1 second. Where is it? Yeah. All right. So, very good evening, and thank you, Dr. Jadhav and Datta, for inviting me. So, yeah, it was great listening to Dr. Brahmavat, but I'll just say a few things to follow from his presentation. So, there's a lot of questions that need to be asked. There's no doubt about that. And if somebody says they take history in 10 minutes and come to a diagnosis and start treating, it raises a lot of concern for me because it takes a while for the client or the patient to have the trust and comfort with the treating doctor to start opening up the true history for what they have come. So I'm not going to go through the history because that's already been done, but I thought it's worth sharing a proforma because this is an accumulation of 13 years of work and the history has been put up, and this is not for patients to fill. This is for the doctors to use as a template. Well, I specialize in sexual medicine only. So that means I spend no less than 60 minutes with each patient, which I can't expect for those who are working in other specialty to do, but you can take what you like and then you can use it as a template. But I'll just quickly run through the different sections. So you start with the presenting complaint, and then we have a lot of questions about lifestyle. Now, anything to do with sex, it's important to also ask about sleep, and especially obstructive sleep apnea, which has got lot of evidence that it can impact overall health and especially sexual health. So sleep is very important. And then the next section, sorry, I think I'll go down. And then about medical and surgical history, medications, once again, forms a major part of sexual medicine. There are a lot of medications that can interact with sexual functioning, especially antidepressants. So it's important to take a good history about medicines. And when we say medicines, it's not just about the allopathic. There are a lot of complementary medicines that we need to understand as well. And then usually we start with less threatening questions, much easier issues like lifestyle and medications or medical history is not that sensitive. And then we slowly move on to a bit more sensitive topics like relationship. And then from the relationship, then by the time you would have already formed a good rapport and therapeutic alliance with the client. And then we are moving on to further questions about the sexuality. Now, one thing I would like to add is gender, and I think it's time for India, practitioners in India to consider gender as a major issue. Because just because somebody appears to be male, we cannot assume they are male. So it's important to ask that question because sometimes it's all about asking. The moment we ask, it gives permission for them to talk about it. So there's a lot of responsibility on our shoulders to open up and put a small pin in the bubble so that things can be seen better. So there are a lot of questions about sexuality, sexual development, past sexual experience. And then I have a whole section on autoerotic behavior. And that's all the questions. How do you masturbate? Sometimes men who masturbate using their hand, and sometimes they rub against the pillow or bed surface, which can have huge impact when they're trying to have sex with a real person. So we need to understand a lot about masturbation, and that was my whole PhD was on that. Now, why is it important to know about the masturbating behavior? Because it is not influenced by another person. It's about how one person has developed, sexually developed in accordance with masturbation. So there's a whole range of things we need to know. Now, this is only just a summary. And then a lot of questions about partnered sex. And I think a lot of this is already covered what Dr. Brahma said. But there are a lot of questions we need to ask, especially those who are working in the fertility, subfertility area. I think this section can be very important for you to ask and have a good understanding. Now, just because you ask the closed-ended questions, is everything okay with your sex life? By default, patients are going to say, yeah. And that is not the best way to ask that question, okay? So these are all the different questions you might want to ask your patients about it. And then we can go into male. If it is not a couple, if it is only a male, you can just look into male sexual functioning. And there are a couple of things we need to ask, especially about early morning erections and what that means. So there's a lot of questions that we can ask, but I'm happy to share this through Dr. Jadhav. So I'm happy to share, and this has been run through by different supervision groups. So it's all sort of collectively looked into, and I'm more than happy to share if needed. Okay, so I will make that available. Now, let me stop sharing this one and let me get my actual presentation for the day, which is counseling. Okay, so this is what I'm going to be talking. Now, it's important to, let me start by thanking the Foxy for inviting me for the second time in the series. And I am a registered counselor as well, because counseling is a profession and it is a protected title in Australia. Okay, just because having a chit chat doesn't make somebody become a counselor. So we need to go through rigorous training and accreditation, and the big body that I represent is the Australian Counselling Association, apart from all other work I do. Now, this is an overview. Let's look into what is counseling, because without knowing what is counseling, we cannot do counseling. Okay, but it is equally important to know what is not counseling, because we think, oh, I've been doing counseling, but why there is no any benefit? Probably we need to look at what we are not doing it correctly. Okay, so then I'll give you a couple of frameworks, and then I will quickly talk about how we can apply counseling in sexual medicine. And then we'll have a quick chat about the common pitfalls where things can go wrong. And then I will leave you with some practical, ready to use tips, which you can literally use it tomorrow. So that sort of tips I will finish it off. Now, what is counseling? Counseling is none but the conversation. It is a very much a dialogue. There's no doubt about it. But it is not just about talking things through, but it's about generating possibilities. It's about generating new possibilities for action. Now, in general sense, we are all very good as medical doctors. We are very good in taking history, talking to our patients. We do the talking bit, but in counseling, while talking, we are also making our clients and patients to come up with new possibilities. And that generation of new possibilities is what makes counseling a special entity. Okay, so that's very important to make that note. Now, what is the purpose of counseling? Why are we even doing that? And Dr. Raj Brahmat clearly said it has to be non-threatening, it has to be confidential. Now, the moment the client or the patient thinks whatever they say in the room is going to be out, they will automatically do a shutdown. They're not going to reveal what they want to say. So it is our responsibility to provide a confidential, safe, and supportive environment. Now, once these three are in place, the situation becomes conducive for the patients to open up and tell their story. Now, telling their story is important, no doubt about that. But merely telling their story is not going to make a change. Okay, for some, telling a story is therapeutic. And when somebody listens to their story without judging and with empathy, and they feel light, they finally got to tell their story to somebody. That is therapeutic, but not always. When they're telling their story, we have to help as a counselor, we help patients to work through their emotions. Now, ultimately, telling a story and working through the emotions, we are also creating opportunities for them to make changes in their life, because it is that change what's going to matter. Otherwise, we are simply going on in round and round. So that's not going to take us anywhere. So what is the counselor's role? The primary role is we have to provide the client with an opportunity to get better understanding. We are not telling how they should live their life. We are not telling them what is important to them. We are not dictating what they should be doing or should not be doing. And the typical tone should not be very prescriptive. Now, as medical doctors, we are very good at giving instructions. We are very prescriptive when we talk to our patients. But in counseling, that communication style will not work. We need to use more of a guiding principle. But let me tell you, having worked in India, now working in Australia, I can tell you a big difference. In Australia, the counseling style, the motivation interviewing, the techniques we use, we very much rely on our patients to think for themselves and help them navigate through the process. But in India, and also Indian patients in Australia, if you use the same principle, the mindset is, doctor, I'm paying you fees and you are asking me to do everything. I'm coming to you because I want you to think for me. Okay, so we need to understand the cultural differences here. So yes, we have to have some prescriptive, but we need to know when we have to do that. But mostly in counseling, we have to use a guiding principle. Okay, end of the day, it's about their goals. It's not about our goals. It is not what we want them to do. It it is about what they want to do with their sex life. And part of counseling, as a counselor role, we also help our clients build some skills that they can readily use in the problem that they're dealing with. Now, what is not counseling? Now, what is not counseling is simply giving instructions, go do this, don't do that. You need to have sex this many times. You have to do it in this position. So it becomes very prescriptive, and that is not counseling. And simply having a chit chat without a framework, without having a proper reason for asking certain questions, and you feel like, oh, I've spent 30 minutes, I've spent 20 minutes, but there is no result to it. That's because we haven't put all that information in a way that the clients can understand and the clients can actually utilize to make change to their life. So it is our responsibility in counseling. It might appear from outside, or they're just having a chit chat. Actually, not. If a proper counselor, they are talking with purpose and they are listening actively, and then there are a lot of micro skills. They are also assessing the body language. So there's a lot of work going on, and we need to collect information for a purpose, with a definite purpose, and then put it in a frame and then give it back to our clients. Now, passing in judgment, okay, or showing any form of reaction on the face, when especially when clients talk about their sex life, can send a very negative message. Okay, and talking but without a purpose or structure, which I already said, is very, very important, that it's to have a purpose and structure when we counsel our clients. Now, distress. These are some of the strategies where we can help clients to overcome distress. Now, if you remember the diagnostic criteria in DSM-5, distress is a very important factor. Now, a person who ejaculates in 1 minute, 3 minutes, 4 minutes, whatever the time they do, or they have an issue with their erection, but they're not distressed about it, technically, as per DSM-5, it's not considered as a sexual dysfunction. So it is the distress that defines a concern to be a dysfunction. So the distress is the emotional side of a problem. So in counseling, the medical history taking, it will deal with all the biological issues, the biomedical issues, but counseling can help a lot in the emotional side of the sexual dysfunction. And therefore, counseling is not an optional thing or a luxury, but counseling has to be made part and parcel of helping our patients with sexual problems. Now, there are different ways to do that. So you can create insight. There are a lot of clients and patients that I've seen who have come. They are good at explaining at outskirts their problem, but they really don't know what they want to get out of it. They don't know why are they really there, what they want out of it. So sometimes creating a better insight is very important. Interpersonal communication. A lot of times, couples haven't communicated between them what their expectations are when it comes to sex. So it is only when they talk to a therapist or a counselor, they get an opportunity to talk with each other. Okay. And self-awareness. Sometimes it's important to create self-awareness of what beliefs. Say, for example, sex, when in counseling, when we do therapy and counseling, we always screen for shoulds. Okay. Sex should be happening this way. Men should be always ready for sex. Okay. So some men hold on to that macho feeling, or man should be ready for sex anytime, but I'm not. So therefore I have a problem. So that explaining to them and providing that education and awareness can be very helpful. Now, problem solving, and sometimes we need to help our patients to help them with problem solving, because they need all the options, and it's important to help them with problem solving. And sometimes we need to educate them in getting some social skills. Sometimes men and women, or doesn't matter who it is, they are very good in pointing out what is not so good, but they fail to appreciate when things are good. and I'm sure you will agree with me, when you give them medications, when you ask them, so how did you go? How did it work? Oh, it didn't work at all, doctor. And then when you start questioning, no, it works somewhat better. So they always start with a very negative perspective, and then they actually work backwards. So we need to give them some social skills as well. Now, this one slide can be a whole day lecture, which I don't want to do, but let me give you some. The point I'm trying to make in the slide is counseling has got its own theory behind it. It's not just talking, it is very much underpinned in theory. Now, these are all the different theories and therapies, and the stars that I have are the theories that I use in my work. And sometimes it's not just one theory. Okay, we tend to use in an eclectic manner, we tend to use bit of both or more than one or three. Now, let me quickly run through and let's see how it applies in sexual medicine. Psychoanalytic is, it's nothing but helping patients become conscious about their repressed memories. This is sometimes this is the Freudian principle where you make a person lie down on a chair and then make them go back to the childhood memories. Now, this model is still a valid model, but in modern day, it's not practical. It takes a long time, but it's great in sometimes for sexual trauma and childhood issues. Definitely it has a role. The behaviorist theory is modifying the problematic behavior, and sometimes that can be related with masturbation. Okay, so sometimes men, if they start doing the rub on the pillow, the surface, they think as long as I'm not touching the penis with my hand, somehow it is okay. So that behavior needs to be modified if they, and a lot of men who do that end up with problem having intercourse. The humanistic theory, I will talk about it in a second because that is the one is very important and mostly used nowadays. The cognitive is all about identifying and changing unhelpful beliefs and thinking process. Now, cognitive behavior adds the behavioral component to it. Now, that is a perfect example when it comes to masturbation. Now, scenario one, a man thinks that masturbation is fine and he knows there is no issues with that. He feels very good while masturbating. He masturbates and then no issues with that person. The second man, he thinks masturbation is wrong and he has some religious reservation against it. He knows if he masturbates, he's going to feel guilty and therefore he doesn't masturbate. That is also fine. The third category is men who think masturbation is wrong, but still enjoy masturbating. So they continue to masturbate. The moment they ejaculate, they feel guilty. While masturbating, they are happy about it, but the moment they ejaculate, they feel guilty. Now, the third group of men are the problematic. Now, the problem does not come from masturbation, the behavior, but there is a discordance between the thinking, the feeling, and the act. So that constant guilt can have a lot of consequences, but not the actual behavior. So that's how cognitive behavior therapy is applied. And then the last one is where we forget about what happened in the past. Let's start from now and let's look at what you're going to do in the future. That's more solution focused, which is straight opposite to psychoanalytic, which is all about the past. And narrative therapy is, and this sometimes I use it as well, where men or women or couple, they got so entangled in the problem that they cannot see the problem from an objective manner because they already immersed themselves. So we need to separate them so that they themselves can actually see the problem. And in that approach, that's all we need to do. These patients can find their own way, but our job becomes to help them separate from the problem. Okay. Now, the reason I'm emphasizing narrative therapy is I'm not expecting any one of you to use any of these theories, but a lot of patients who have come to me in the last 14 years thinking they have something abnormal, it's not because they necessarily had something abnormal. they didn't know what was normal. Okay, so they saw themselves in the problem. But as a therapist, as a medical doctor, as a specialist, you educate these patients and help them see the problem as a small aspect of their life. A person with so much of success and career and everything, they are crumbling on one particular issue just because they cannot last for 3 minutes. Their entire life is reduced into a problem. So it's important to lift them out of it and see sex as a part of their overall life. And within sex, ejaculation time is a smaller element, and let's work it out. And that gives a lot of hope for the patients. Now, person-centered approach. Now, this is the humanistic approach I told. Now, in a person-centered approach, the person whom we are counseling has control. Now, if you imagine you're going in a car, it is the driver who has to set the destination. The GPS job is only to guide wherever we want to go. It's not the GPS that decides where we want to go. So in a person-centered approach, a counselor's role is like a GPS. It's the client who decides where they want to go in their life. And we guide them. We can show them there's a police patrol there, there is a petrol bunk there could be a traffic jam in this road. We can give all those alerts and we can show this is the fastest road, this is the shortest road. But end of the day, the steering is in the client's hand. So they are the ones who are leading it. And our job is to make it safe, confidential, and support. So that's what person-centered approach is. Now, there are different phases to counseling. Now, it's very lengthy because counseling is a very lengthy, a very heavy reading. But let me give some very important tips. In the beginning phase, it's all about forming a therapeutic alliance. And Dr. Brahmabat clearly said, it's all about having the trust. And why should I talk about my sexual problems to you? So the client is also constantly asking that question in their mind. I came to this doctor, but why should I tell him? What if he goes tells anybody? What if my being recorded somewhere? So we need to create that sense of safety and have a good working alliance. Then once they trust us, then they're happy to self-disclose and tell all their problems to us. Now, at this stage of counseling, we are not in a rush to come to a conclusion. We are only doing a tentative assessment. The middle phase is where all the work is happening. And this is where we are trying to understand the origin and maintenance of the problems and what are some of the patterns. Sometimes you draw parallels in different aspects of their life. So this is where the lot of work, the machines are running, all the wheels are turning in the middle phase. Now, what happens in the middle phase is this one slide. Remember, why this person? Why the problem is happening now? What is keeping the problem? And what is good in this person? My belief is every patient, every couple comes to me or to any sexual specialist is they all have something good in them that we can identify and use it to our advantage and to their advantage. But in simple, in the middle phase of counseling, we are trying to understand, trying to assess the patient or the couple, why this person is predisposing, why now is precipitating, and what is keeping the problem is the perpetuating. Now, there are a lot of examples. I'm happy to share this, the slide. I've already sent it to Dr. Jadhav. I'm happy to share it. You can read it later. But I'm not expecting any one of you to do this, but as a specialist in this field, and I like documenting and collecting information in a systematic way, and it takes some time after the actual consultation time. This is how we process information. So biomedical, psychosocial, interpersonal, predisposing, precipitating, perpetuating, protective. So once you start charting information, then you can clearly see, okay, the lot of issues in this patient is something to do with psychological. So therefore, it is important to recognize that psychologists are there. Let me refer them to a psychologist. If a lot of issues are in the biomedical side, then okay, I'm going to treat this problem. If it is more on the hormonal side, then we definitely need an endocrinologist. So this formulation helps understand how interdisciplinary care has to be implemented. Now, the ending phase is very much, it depends on some patients, 3 sessions, some will go for 6, but then there are many patients who have a brief intervention. But this ending phase is where we consolidate all the learning and changes. And when it's important, when we deal with sexual problems, when we are giving them skills and teaching them some techniques and how to deal with the problem, they're not only using that in sexual problems, they will use that for so many other issues in their life. So it's important to provide our patients with a nice consolidation of their learning and change and encourage them. Now, some of the pitfalls. Now, when we start trying to counsel patients, okay, now I'm being very mindful that gynecologist or any medical doctors, you're not going to do a full-on counseling. You're not going to spend 1 hour sitting for 6 sessions. It is not possible. It's not practical. But using the principles of counseling within your current work is possible. Okay. And I will tell you how to do it in a minute. But before going there, it's important to answer. These are questions for your self-reflection. Now, my patient would feel bad about me questioning. I think Dr. Brahmat actually mentioned some of them. And one of the reasons why doctors don't ask about it, because they don't know what to do with the answers they get back from their patients. Therefore, I won't even open. And so these are all the what ifs that is going on in the mind. Now, we call it in psychology this as thought fusion. If you start asking what if 3 times, you are not going to make an effort to do anything about it. The best thing is to do is to avoid and move away. Okay. What if I don't know what to do with how to ask a question? What if I don't know what to do with the response my patients give? What if I ask something very silly that could offend my patients? So if you ask 3 times what if, you will come to a decision, oh, this is too much for me, I'm not going to do it. And that's where we are not able to progress in helping our patients with sexual problems. And we think somebody else is going to deal with it, and they never get dealt. And then they rely on Google, and they rely on folklores and all the less credentialed people out there. Now, the dilemma is, do I need to know everything before I should ask? Or I can be very honest and tell my clients, look, I'm not an expert in this field, but I'm very honestly willing to help you. Let us have a chat and see what I can do about it. You don't want to pretend as though you know everything, but then when the patient tells you're not able to understand or comprehend or help them, but at the same time, ethically, you want to help your patients, because that's one of the ethical principles. We want to help our patients. So you can make it okay with your patients. You can say, look, I'm a gynecologist, I'm an expert in this, but I've had some training and I want to help you. Let's have a chat. Let's see what I can do for you. And that's good enough. And patients will actually appreciate that effort. Now, this is sort of how to kickstart that conversation. Okay. Think about sexual problem when they're coming for subfertility or when they are presenting to a gynecologist. And it's important to think about it. What the mind doesn't know, the eyes won't see, the ears won't listen as well. So only when you think about it, then you can ask questions and pay. And active listening is part of counseling. What we mean by active listening is we are not just listening. We are listening at the same time processing the information in the back end. So that is what active listening. Now, talking and listening can be therapeutic. Okay, so you might think, oh, I didn't do much, but from a patient perspective, they felt liberated because they finally spoken to someone about their problem. Now, this is the implicit model. Now, permission is important. Now, at every stage, it is important for us to give explicit permission for our patients to talk about their sexual problems. Now, when they come to me, that permission is already granted because they know I specialize in this field. So that is why they're coming to me. So they have permission to talk about sex. But when they're going to a gynecologist or other specialists, they don't get that sense. Oh my God. And in Indian culture, medical doctors are seen with a lot of authority. Okay, so it's seen as a fatherly figure with a lot of respect. So that can actually form a barrier. So it's important to give permission. And when I started working in Chennai, actually the board, it's in a main arterial road. The hospital had a board, sexual medicine, in the front. You won't believe how many patients actually came in just by looking at the board. Because from a patient perspective, if the hospital has sexual medicine, that means there is someone in this hospital who can talk about it. So it was easy for them to go ask the receptionist, okay, I saw the board sexual medicine, who is there to talk about it? And when we don't have any of that, they don't know whether they can go ask about it. So limited information. So permission is about giving permission for patients to talk about it and then providing education. And sometimes telling what is norm and what there is. In lot of things in sex doesn't have a norm. Okay, it is all artificial or it is based on some limited data. So we can actually give a lot of information and okay to share their feelings. It's okay to feel the way they are feeling. Okay, so we can give permission for a lot of things in the consultation, and that in itself is very therapeutic. Okay, and and it's okay to not be sexual. Okay, and sometimes they feel excessively pressured that they have to respond to sexual initiation by the partner. Now, I totally agree with Dr. Brahmat, whatever he said, but the last slide, what John Bancroft said, I have a lot of respect for him, and his wife is the editor of one of the book chapters that I wrote. However, not all men always want physical, and not all genital, and not all women want relationship. Now that clear boundary is fading. Okay, there are some women who just want genital response, and there are some women who really like the relationship. And I had a gay couple in India. One guy was a French guy, and the other guy was an Indian guy, young guy. And this guy had lots and lots of sex, the French guy, whereas the Indian guy didn't. But the French guy loved the Indian guy so very much that he doesn't want to have sex with him. But for the Indian guy, if you love me, then you should be able to have sex with me, isn't it? But in fact, that's not true. You can love somebody so much and still not have sex. On the other hand, you can have plenty of sex with one person and still not love them. So love and sex are not equal. So we need to have that understanding. So I thought I'll just plug that one. Limited information is one step further. Okay, the next step from giving permission to talk and giving some basic education, then you can go doing some basic assessment. Say, for example, if a person has an early morning erection, okay, then you can have some understanding. So the mechanics of erection are still fine. And then if a person is able to do everything fine with masturbation, but not with intercourse, then you can get some direction. Now, one other thing I want to say to the audience here is sex is not equal to intercourse. Now, this is a big thing that I'm focusing now. Actually, I'm doing a talk next month on this one equation. Now, when we take history, we typically ask patients, so how often do you have sex in the last 6 months? They say once every week or twice a week. But then I give them a definition of sex. What I mean by sex is the touching, kissing, cuddle, kiss, naked, nudity, rubbing, everything, and intercourse is also part of it. Now answer me how many times you have sex in the last 6 months. Oh, that we do 4 or 5 times in a week. So in a patient's mind, when we ask about sex, they're only referring to intercourse. But sex is much bigger than intercourse. And the moment the pressure, the focus of intercourse is removed, sex can be very pleasurable, and there are a lot of acts in sex, we call it as outer course, that are equally pleasurable, if not more pleasurable than intercourse. But this is sort of information you can have a chat. Once you have that confidence, you can have it with your patients. Specific suggestions, context specific, the dysfunction specific information. If you have the right knowledge and if you have the confidence, you can go ahead and actually tell them some specific suggestions. Okay. And say, for example, can I increase my penis size, by masturbating? Is masturbation it's unhealthy practice? So these sort of specific suggestions, you can do it. I'm sure the masterclass series would enable you to give some specific suggestions. Intense therapy, which I don't expect you to do, but if you have a counselor or therapist working or psychologist, then you can definitely work with them. And if that person is willing to learn more about sex, then you make a great couple, a medical doctor with, in obstetrics and gynecology, and then you have a counselor or therapist specializing in this field, then you both can come together. Now that's a paper which has got a lot of information about the implicit model, which once again is readily available. Now let me finish. I'm very mindful. I have 4 minutes left. So the practical tips. Do not be in a rush to give a diagnosis. Okay, we are not working in the US where everything has to fit into DSM-5 in order to help our patients. When a patient says that and it happens when you ask a patient, how can I help you? Or doctor, I have erectile dysfunction. Okay, let me tell that at the end of the consultation. Now, just tell me what is your concern. Oh, doc, I'm not able to keep my erection. Okay, let's work from there. So I would encourage to start with a descriptive diagnosis rather starting with a definitive diagnosis. Now, the second point is do not assume. Okay, and it's okay to ask question. And I tell my clients, sometimes I have to ask the question more than once. It's not that I don't trust what you say, but it's for me to make sure that what you say and what I understand are the same. And educating patients to view sex beyond genitals. And Dr. Brahma clearly said, brain is the main sex organ, and that somehow shifts the focus of a lot of patients from genitals to a whole body. The whole body can be considered as a sex organ, but more on the brain. And the 4 factors, why this person, why now, why still on, what works, it's very important to have that framework in order to assess your patients. Whenever possible, I'm stating this, whenever possible, please ask question about the partner, if they have a partner, because sometimes the information we get from the patient about the partner may not be what the partner actually is going through. So please remember the partner. And I'm very confident to say that every obstetrics and gynecologist are also a sexologist, because reproduction is part of sexuality. So therefore, every one of you also a sexologist in a way. So please remember, you don't have to be an expert in the field of sexology to help a couple simple sexual problem. Okay, so have that confidence in you, and do not rush into diagnosis, because all you're doing is you're giving a label. Now, when medical doctors rush into giving a diagnosis, run a lot of investigations for no reason why they are doing all those investigations, everything comes out normal. The medication they have given, but they haven't given enough advice on how to use the medicines. The medication is not working. The patients start thinking, I have gone to a good doctor, I have done the right thing, and still my problem is not fixed. Therefore, I'm a failure. The patient wouldn't know that the doctor hasn't done the right thing, haven't gone through all of it and take the right history. They simply believe the doctor has done, I've went to this big doctor, even he cannot fix my problem. So they are running with the label in forehead that they have erectile dysfunction, and that can have a lot of psychological distress. So basic lab tests are more than adequate, and prescribing medicines, make sure you give a lot of instructions, and always remember, no one person can treat all sexual problems. You need to acknowledge that and make referral and have a good team that you can work with. All right, so that's the end of my talk.
You have to unmute. Apurva, unmute yourself.
Sir, I'm extremely sorry. Thank you so much, Vijay Sarthi sir. It was wonderful. Actually, what you have said earlier, that counseling itself is a different branch, different part. And even with that, you have so us such in simple way. I think definitely we gynecologists learned a lot from you about the counseling part today. And secondly, which I want to tell you that definitely what Rajsekhar sir has told, we gynecologists actually give a very, very small time to our patient. And this is the main problem. And in case of, to extract the problems from our patient, definitely we have to give a lot of time, ask them politely, patiently, and not only ask them, we have to listen from them. This is very important. But what we emphasize from the starting of this series, we gynecologists are the first one who get these type of sexual problem. So, and unfortunately, till now, no medical schools, no medical, courses, no medical syllabus anywhere, including sexual education as their part. So this is a very important series going on. And thank you so much, Vijay sir. I must congratulate you for your wonderful talk. So we now we learned about the history taking. We already learned about how to counseling part. Now the basic things which I am basically a gynecologist, and what I have in my mind after seeing all those things, that how to start to have our sexual medicine OPD and sexual medicine practice. So this is because it's not like in that ki, we are seeing dealing with the patient of ANC antenatal, and in the mid we just taking the patient of the sexual problem. So how to start this? This is a very important questions we have, every gynecologist have there in mind. So for that, how to start this sexual medicine practice, sexual problem, to discuss with that, we have a very eminent and particularly very my favorite Sunil sir. Thank you so much, sir, for joining us, to blessing us. So over to you, sir, in a very simple and straightforward way, how to start this sexual medicine practice along with our normal OPDs, gynec and
First of all, thank you so much, Dr. Purba. Thank you so much, everybody, for being here. Dr. Rajsekhar, for the brilliant talk which you gave. Dr. Vijay Sarthi, for the always mesmerizing truth of the way it should be about sexual medicine which you present. Dr. Neeraj, as usual, you have taken up this challenge of this country to do this job. And Dr. Purba, though you're always late, but let me tell you one thing, nothing can happen without you. And Dr. Shah, of course, I've been seeing you for ages. And I always see this smiling face, this time with a different mustache, which looks even royal and better. So thank you so much for being here, sir. I'll first of all share with you of how I got into the small part of sexual medicine which I practice. So I'm originally a surgeon and have done a lot of urology, and in Maulana Azad Medical College, the urology department was with the surgery department because there was no MCH at that time. So we had a urologist, Dr. Ram Chandramurthy Kaza, brilliant man. And this is, I'm talking about 1991, sir. So in 1991, he started a whole system of sexual medicine. So you had non-scalpel vasectomy, you had microsurgery, and at that time, there was one injection which was known as Pepavary. So what used to happen was there were no PDE5, there was just one injection known as Pepavary. So something very interesting used to happen. Maulana Azad Medical College is at Delhi Gate. And at Delhi Gate, there's a very big bus terminus. So all the residents were told that please keep the injection ready. You will have to inject it between 4:45 to 4, because 4 o'clock, all the buses had to rush and all the lungis were ready. Please understand what I mean to say. Everybody had to take the injection and rush into the bus to go home because they needed to. So it was a whole different story altogether in those days. So sexual medicine, I got introduced for the men. And for women, it so happened then when we started in 2000, the reproductive medicine unit, a lot of women of vaginismus came and they used to come to get test tube baby done. And what used to happen was they would come and say, we don't have children, we just want children. We just do not want to talk about sex. And we don't want any relationships. It was a very funny kind of a story. And with these women, we actually realized that they need to have the most important thing which is needed in life, which is intercourse. And so the female part of it, my wife is also a gynecologist. So we got into the female part of it and slowly developed the sexual medicine part for the women. So that is how it started. And most of the people over here practice gynecology, practice reproductive medicine, and we get so many patients who need to be taught about sexual practices, and we just wonder how to go about it. So I really thought when Dr. Neeraj gave me this that I've had a first-hand experience. So I'll just be able to speak about my experience. See, I am not I'm not Dr. Kothari, I'm not Dr. Raj Shekhar, I'm not Dr. Vijay Sarthi, who are people who have dedicated their lives to sexual medicine. I'm one person who has dedicated my life to so many things, and along with it, I love to learn. So I just got into the line, and I love it. So
We
I'll
can get better with you. So,
yeah, yes. Well, so I'll just start and I'll just go into some deep concepts which I have understood. More, see, there is no point of telling everybody you need a finance, you need a clinic at the right place, you need internet marketing, you need this. No, no, no. I'll just go into the deeper parts of my own being, which I have actually felt, and I'll just go into them, and I'll just share. So to begin with, I would really begin with one basic thing. If there is yeah, can you
सुनील सर बीच में आवाज कट रही है. I think there is some network issue.
We are not getting voice.
just a minute?
Yes.
I'll have to just boot in again.
Okay.
There is some issue. I'll just. Can you see my slide share, please?
No, we can't see. We are just seeing that you have started screen sharing, but we are not able to see any slide. You have to unmute yourself.
Now it's visible, sir, your slides.
You are muted.
Yeah. Now I think it's fine.
Yes,
There is
sir,
there's
it's fine,
some
sir.
issue.
Absolutely.
There is some, there is some kind of a premature ejaculation in the system in which I have. So it just suddenly went off. So I think that's what has happened. So I would just come in. Yeah.
Sir, उसको जाना ही था, sir. We have such a great sexologist with us. 3 धुरंधर महारथीज हैं, तो जाना ही था, sir.
So I just want this sex to continue at the moment. So therefore over here. So let us just consider one small thing. I think the biggest disorder which human beings have in the world is sexual disorder. A place where you have 31% of women reporting one sexual dysfunction regardless of age, and where 43% of men have a problem at some time. In fact, except for premature ejaculation, which will increase with age, and something on which life is going to depend, sexual harmony would depend, marital relationship would depend, and in fact, the whole esteem and the ego, and I would say the whole being of a human being would be there at its sex. So over here, despite it being like this, we have such few areas in which we would have somebody who would be there to look after this problem. So sexual medicine per se would be diagnosis, treatment, as well as prevention, we understand. But just like Dr. Vijay Sarthi and Dr. Rajashekhar said, it's a multidisciplinary approach, and it involves a physician, a mental health worker, a professional, social workers, and sex therapists. Now, the fact remains, to have a sexual medicine practice which is complete, you need a whole team to work together into actually making it there. But we individually, as human beings who practice gynecology, andrology, can be the main people giving support. And in case there is something in terms of a multidisciplinary problem needed, we always can refer them. So sexual medicine physicians would normally give medicines or do surgeries, but sex therapists would also be there to give a behavioral treatment.
सुनील सर, नीरज सर, शायद मुझे लग रहा है फिर से उनका कुछ नेटवर्क इशू हुआ है. Should I call him?
No, wait. Just wait for 2 minutes. It should be okay. Do we have any questions? Meanwhile, we can have.
Yes, sir. वही मैं देख रहा था, sir. And questions उसी पे एक था, sir. How to start those clinic? And Vijay, sir, they want actually that proforma which you have.
Sorry.
He will send us.
Sorry, what was it?
Sir, that history taking proforma. People liked it, and the history taking proforma was they want if you can share with the audience.
I'll send it to your email. And then you can send it.
And for Rajsekhar, sir, there is a lot of compliment for you, sir, about your presentation and about the history taking. And even one lady from Pune, one doctor from gynecologist from Pune, she stated that we never thought that it was so easy before. We usually thought talking about and taking the history about the sexual problem will be a very difficult task for all of us. But you made it such a easy and such a palatable to, in fact, for the patient also. So he congratulate you, sir, and say big thanks to you.
Brampad, sir, I have one question for you.
Yeah. Somehow.
1 minute.
Please.
Brampad, sir, I have one question. Hello. Are you able to hear me, Brampad, sir?
Yes, I am able to hear you.
I have one question. You said that you have to maintain privacy and no attendance also should be there when you are taking history of the patient. So, as far as the male gynecologist, how it's possible to take a history of female patient without any attendance?
Right. Now, you know what you have to do, that when you are examining, you must have an attendant.
Yeah.
But when you are taking a history, what I do generally, so many times there are husbands which are paranoid. So you keep a door open. See that nobody is there in the room or in your cabin. You are talking to a person and there is nobody around you. So people can see you what you are doing. So you won't have to worry about it. There is somebody who records, with the permission to the client that can I take the recording for my further studies. So he or she has a recording proof even that there is no problem, because what you are saying is very right. Today, for a male gynecologist, somebody wants to sabotage your practice or do something wrong, it becomes very easy, And so many times we see a lot of media people come and try to do something. So you have to be very, very careful. And that's why I'm very clear. And that's why I generally avoid, I have not examined patient. My wife, she's a family physician. So I ask her to examine. And that is again, an examination can be three things, It can be therapeutic, it can be diagnostic, and it can be educative. So it's a little different for what you do in a gynec examination. And that is what you have to work it out. So you are absolutely right. You have to learn to safeguard yourself. So keep a door open. I'm sitting, she's sitting across me or side by. So everybody can see from outside, but what we are talking is not going outside. So it's a very, very important aspect.
But then what happened? Relative or husband or who is accompanying that lady will be there standing near the door, and lady will not open up.
No, I didn't get your question.
You said that you keep the door open, right?
Yes. Yes.
So,
But
that attendance with the lady, maybe her husband or any relative with her, standing near the door, and so lady will be not able to open up about the history.
You have to keep a distance. Tell them that nobody should be here. It should be about 10 to 15. And you talk in a very soft, voice. So you say that nobody should listen. It is our private talk. Or if at all required today, the phone is there. You said that you start your phone and on the phone you can talk to me. Or tomorrow, after going to home, you can answer these questions. So there are many ways which you can do it today with this gadgets available. I think one can be able to do without any problem. The most important part, I'll tell you very honestly, women are most honest. They are not hypocrite like a man. For a man to admit that they have a sex problem is a bigger problem. They say it is better to live with the problem than to accept that I have a problem. Well, female, they do not mind opening it up, and you will just, the moment you have built up that bridge I called a trust, they will open up like anything and they will tell you everything, because they see, normally just see any girl when she's growing up, the first thing around the menstruation, wearing the bra, she talks to the mother, Masi, or anybody. When she gets a period, she goes to a gynecologist. And many are safe with the male gynecologist. They think they do much better. These are so many people, they feel like that. So all those things, and all throughout in their life, during the infertility, pregnancy, abortions, all, or menopause, they are in constant touch with the doctor. So talking about their sexualities, I'll tell you one thing. Just ask any of your client when they are sitting in the afternoon in the office with eating dabba, they will talk about their sexual life. Mother and daughter will speak, but the father and son will never speak about. Or if you are working in an office, your colleague will not ask, peda kab khilata hai, 2 saal ho gaya. They will never ask. While female, they are constantly right from bhaji wali to their own mother to mother-in-law, and they feel really frustrated. And being a male chauvinistic society, the whole comes the blame on her. And the moment the blame comes, one day she blasts, says it's your son who has a problem, and then everybody, the reaction changes. So I'm saying it is very easy.
So Sunil, you can go ahead with your presentation. You can switch off your video, I think, Sunil, then it will be better, I think. You have some net problem. So if you switch off your video, it will be.
Yeah. Now is it okay?
Yeah, it's okay.
Yeah. So there are 3 concepts and 10 actionable points I'll talk about. So though the concepts have been mentioned, but one of the concepts which I'll talk about is the first important concept in a very busy OPD is trust and confidentiality. And it is very important for all of us to understand one small thing, that you in a busy OPD cannot think of doing sexual medicine. So what you need is, you need to give them another time. And it has to be a room which is closed, a room where they feel that they have come and are safe. And the most important thing is, the couple is only going to open up to you when they feel that they are being given time. So you would have to take out a different time for them. The second concept, which I'd like to give to you is, it is to be treated like any other disorder. Please understand, you yourself have to be comfortable with it. Till the time you are not comfortable with it, you will never, ever be able to give comfort to the other person. It is a basic idea, and the basic idea is, I think there is some disturbance in the microphone somewhere. Some other microphone is running. Dr. Burba, could you mute yourself, please? Yeah. So the second thing is, it needs to be treated like any other disorder. And now just understand, when a patient comes to you, and if you're a gastroenterologist and you consider that, well,
Sir, I think again there is
with sexual problems and the language, as you would be with anything else, for the patient to be comfortable. And the third important thing which I have spoken about as a concept is that it needs a multidisciplinary approach. So like, I still remember we have a counselor in our city. So we actually engaged the counselor, asked her to learn about this, taught her whatever we knew, so that at least there would be somebody to counsel and give time to these patients in a system which can be developed. Therefore, it's very important to know this. And the fourth most important thing is that the concept of wanting to learn sexual medicine is equally important. So now 10 actionable points I'd like to talk about for even medicine, for that matter. The first thing is, you need to be self-reliant. You cannot think that you will be dependent on anybody else. In life, you've got to actually go ahead and learn things. And the moment you start learning things and you depend upon yourself, the patient sitting in front of you will actually depend on you. So it's very important to have that particular self-reliance. The second thing is, you need to be fixed on a goal. You don't have to decide that, well, I'm going to practice sexual medicine one day, someday. No. You decide you're going to put up a practice, plan and add it within the next 2 to 3 months. And you're going to have a place where you're going to invite those patients without there being too much of people around, and in a separate time. You would take the time out to get yourself trained, and you'll also try to find somebody who actually could sit down and do the long counseling. You also may need a pelvic physiotherapist when it comes to vaginismus treatment. And believe me, it's something which has not been taught to any physiotherapist. But if any lady physiotherapist you could teach, I think that would be the best thing to happen. The next thing is, you need to be responsible. I mean, responsibility, I still remember and never forget. A long time back, I did a program in which it was there that responsibility is not a burden. It is not anything on your shoulders. It is just a place where you need to stand and make something out of your life. So even if you want to do a sexual medicine practice, you need to do it very responsibly, because it's a very tricky line. The next thing which I always say, and I always say, you need to be a fast implementer. If you have decided to do something, please go ahead and do it fast. Do not leave it that one day I will have a sexual medicine practice. Please learn whatever you need to and start implementing it. And this would be very useful to a large chunk of population. In fact, I feel these classes, these master classes, these training programs, which have been done by Dr. Neeraj Yadav, are amazing because these programs have been able to bring out and open up this subject greatly to so many people. Believe me, just like today we are speaking on the net and discussing, this never used to happen earlier. We have not been taught this subject in medical colleges. Children are not taught this subject in schools, but we need to be there so that we may be a part of this whole system of teaching people. We need to be persistent, which means we need to go on doing it all the time. Essentially, we do not need too much of paraphernalia in sexual medicine. So we do not need too much of investigations. We do not need too much of, I would say, equipment. We really need two things: patience and patience. And since the first stop is always gynecologists, we should be the people to open ourselves up to these patients and give them some time. Just like in the lecture of Dr. Raj Shekhar, he said, of what exactly you need to be conscious about. You need to be very creative. I have realized that we as doctors are phenomenally creative. When we get out of medical college, we know nothing about finance, we know nothing about management, we know nothing about HR management, we know nothing about nothing. But we develop everything creatively. And sexual medicine is the most creative line because the problems are most creative. Let me be honest with you. I think if you see anybody with a magazine, you would realize in the magazine there are two things which people look for: sex and crime. It is something which excites every human being. But you also realize that this is something which is the biggest taboo, which everybody closes the book or the magazine or changes the channel the moment anybody else comes in. I still remember, it was a long time back, I used to go to this uncle's place, and this uncle always used to be seeing fashion TV. So I always used to look at him, and the moment I would come, he would change the channel. So one day he couldn't change the channel, and I looked at him, I said, and before I could say anything, you know what he said? He said, kis tarah ke channel aajkal chalne lage hain? So the truth is, that is a society we we live in, but we need to be creative for this subject, and it's a massive subject. I mean, you have patients all over, and they need you. You need to be humble. You know, this is a line where you need to listen to people. Humble doesn't mean not loving yourself. I think you need to love yourself, but being humble means, as a doctor, at times in our country especially, you develop a different kind of an ego where you are not questioned. But this is a line where you need to connect with the human being. And after connecting, you need to really listen to this person, to understand what is going on in their life, to be into their world, to help them. You need to be a giver. I mean, you have to give not only time, but you really have to give so much of patience. And let me be honest, for all those doctors and Dr. Neeraj to create this program for everybody, and charity does not only mean money. Charity actually also means to give what you know to people, which could be given to other people for it to grow for humanity, which is exactly the way I think. And the last, of course, is spirituality, where I feel each one of us ultimately is the same being, connected to all of us together. And this is what sexual medicine is all about. So I would thank you very much. Thank you very much for this amazing series. And thank you so much for being here. I just wanted to be a bit different because it's something which, to start a practice of sexual medicine, there are a few things which I think you need, which I told you about. Thank you very much.
Thank you so much, sir, to give us most practical tips. I think definitely it help us to start our sexual medicine practice. And definitely we are all listeners were very benefited from your these practical, very practical tips. Sir, Neeraj sir, actually, it was not related to these topics, but one viewers actually asked a question, and it is more about the during history taking
Yes.
to Rajsekhar sir. Actually, he wants to know, okay, sir, you are talking about making environment, a good environment, a healthy environment, like talking, like have a very smell should be good, your everything should be clean. But he just want to ask then why there is a erection during the rape when the victims are against it and the atmosphere and everything is not favoring have a sex, then why there is an instant erection in those cases?
See, the rape people, can you hear me?
Yes,
Yes.
sir.
Yes.
Definitely, sir.
The people who rape, the rapist, they are different characters, number one. Sometimes they are what we call perverted. Sometimes they want to take a revenge. And as I said, I always say this one thing, that suppose if 10 different women are there in one room, in a different room, and you are potent, and if you go and have sex with anybody, the person will say, I can enjoy with anybody. But if you tell a woman, it won't happen. So man, whenever there is a partner available, he's seeing her as a object. He's not connected it. Either he wants to revenge, or so many times I'll tell you, in a city of Bombay, okay, if you see the people who are coming from, say, north, south, or anywhere, they are staying in one room where 15 or 10 people are staying. What is their sex life? So they are hungry. So the moment they see a body, or moment they see that somebody talks to her nicely in a building, that does not mean that she's giving. So they are not worried about it. Their erection comes up immediately because they are hungry for a days together. Well, in case of a rapist, they are not bothered. What I said about, in a situation, I say, if a husband and wife, if they want to have a good sex, it should not be, if you come to a railway station in Bombay, say at Andheri I'm staying. So if you take a glass of tea, the immediately saucer is removed and they say 10 rupaya. While you go to a 5-star, so let it be a 5-star luxury. The moment you go there, you select the place, they come and ask you that, would you like to have water? Do you want a distilled water or distillery or something? Do you want a cold one? Then they come and give you menu. Then they start. So it's a 5 stars this thing. So I say, when you are entering in your bedroom, it should be like, and you are entering into Garbhagruh of your mandir or a temple. You should have a good bath. It is a sambhog. Both of you should be able to enjoy. And many a time, can you imagine the people whose teeth are there, bad smell? And recently, I'm treating one of the top person. He's a multinational company, a CEO, and his wife, she comes from a Delhi, and she says, Doc, he's not taking bath, he's smelling very badly, his perspiration, it doesn't change the underwears. How can you have a sex? So people have that atmosphere will make a difference. Just see, any gift, if you give them in the hand and when you package it and give you, it is different. So the same thing will make a lot of difference. I hope that you got your answer,
Yes, sir.
because
Definitely,
rapists, they
sir.
don't see anything. It is just an object for them.
Object. Correct. Very true, sir. Very true, sir.
And
Uh,
believe me, when anybody is watching a porn, if they are interested or just reading something erotic material, they will get, without their knowledge, a erection. I remember a policeman was traveling in a bus. Now he had his wife, and he was having sex outside, and he could not do at both the places on the same day. So he says, "मैं कमजोर हो गया हूं." I said, "What happened?" He said, "Previously I used to carry a half a kilo or 1 kilo tea, and I used to put and sit in the bus next to somebody. And if some good-looking woman comes, the packet used to go up." So it does not require. What I'm saying is an ideal situation. See, counseling also, as I told you, ideal situation. But I have done one of most difficult counseling in the most difficult way. We were traveling in a cruise in USA from San Francisco to Alcatraz. There was a couple I knew. I knew that they had a problem, and she had talked to me. And believe me, 35 minutes going, 35 minutes coming, in that crowded this thing, I could do a counseling. So, and so many times, if you see in a counseling, they are asked to sit next to each other. Yesterday, you would have seen the Biden and the Putin, they were sitting, the same, in the same level. But there can be a big table, but you can make a person comfortable. So it comes with a practice. Start from tomorrow. And then you will come to know, Dr. Saab, you will call me up again, next day, that I find it difficult. Those words doesn't come up. As I said, first be comfortable. Ask, as you are asking, kaisa period aata hai? Do you get heavy bleeding or low bleeding? You get a pain. Same way, ask that, how is your sex life? And you will be able to, you will see that she will be thankful to you.
Very true, sir. Very true.
In fact, for us, it is so simple as doctors to just be comfortable ourselves to be with the person in front of you. And just, I'll tell you, counseling is beautiful because after some time you start enjoying it. And you
As you
start,
said, sir,
yes,
spirituality, I like it. You go one up in the life without going to any temple, without going to any Baba. You become a different person because you are all the time seeing empathy, the pain in other person, and you are trying to help out. As you said, giver. You want to give. I don't want to take along with me. And Corona has taught us that it is a time to redesign, relive, and rethink about your life. So I think it will be the best thing.
Sir, yes, sir, we already passed the time, and we discussed almost all the and every aspect and every questions.
My wife told me that you were 6 minutes more and you did not suck me up. Thank you very much for it.
Sir, actually,
listen another 15 minutes also.
Sir, Rajsekhar, sir, I am telling you one thing very frankly. Usually, क्या होता है, as a moderator, we are supposed to look on the clock. Okay, that it's a 45 minutes and then I have to interrupt. Sir, please do it fast because your time is fast. But literally, I just forget to see the clock. जब आप बोल रहे थे, when you are giving your lecture, मैं भूल गया सर देखना कि, and when you said कि we stop, then oh my god, अच्छा सर का 45 minutes हो गया. It was so lucid. Thank you so much, sir. It was wonderful.
Sex is one thing. It's a 5-star experience. It's not wham bam, thank you, ma'am. And in a USA, after spending the whole night with the partner, while putting the zip, they say, by the way, tell me what is your name. So I think, and somebody said that the sex does not mean an intercourse. It can be with the eyes, with the full clothes on. And the most important part, which I did not talk much in detail, is the touch. The touch can make a whole difference, and that is what, is a very, very important. I'm thankful that you gave me a little more time. Because, when I'm talking, I have never written this thing lecture. It is impromptu. And right now it is difficult. Otherwise, there are many jokes and other thing comes up because there's an audience. Otherwise, here, I don't know what I'm talking, whether it is reaching or not, and how many people are watching.
I think, Dr. Brahmbhatt, it's time you got used to talking to the camera. Because
Yes,
now for some time, the only audience is the camera. And believe me, sir, when you go to a conference, there are 100, 200, 300 people, it's different.
Right.
But today, when you speak to the camera, there are 800 people listening to you.
But I'll tell you one thing, that recently I was attending one of the conference at Solapur where I was awarded, and there somebody spoke on a cyber sex. A person can be here, the partner can be in, San Francisco, and they are feeling that they're enjoying everything. Maybe that tomorrow I'll be jobless. That's what I'm feeling, the way the sexuality is changing.
Also, technology is a great boom because otherwise 3 people from the west, 1 people from the east, 1 people from the north, and 1 sitting in the Australia. How they can make this?
Absolutely right. Absolutely right. It's a boom.
Sir, in between, ये जब चल रहा था, and when you are delivering, one doctor from the extreme northeast, in Dibrugarh, he called me up, and he's a very senior, and he's a gynecologist. He told me कि भाई मेरे को link नहीं मिल रहा है, please send me the link. So this is the beauty, sir, and about this, कि people at this age and they are practicing gynecology, they have a excellent and brilliant practice in obs and gynae, but still they have interest in sexual medicine and treatment for the sexual problems.
In fact, let me tell you one thing. There is nobody on earth who's not interested in sex.
Correct. Absolutely right. Absolutely right.
So medicine, yes.
But, I had given an interview in one of the weekly, and their circulation is around 3 lakhs. 3 lakhs, readers are there. They told me only 2 issues are being sold like anything like a hot cake. One is a sex and another is on religion. Any babas, and that issue will go also. I think these are the 2 issues which are there. So there are Ram Katha going on. I always feel that I should start a Kam Katha at every corner.
Apurva, now you can go on vote of thanks.
And and Mr. Harish Bhimani, you must have heard his voice in the Mahabharat. मैं समय बोल रहा हूँ. So last time he was talking to me, he said, आप ये सब पैसे कमाने तो आप बाबा कामेश्वरानंद जी बन जाइए और मैं समय आनंद बन के आपका असिस्टेंट बन के हम पैसे ज्यादा कमाएंगे.
Thank you, sir.
Sir, before sir vote of thanks, because I think the guest of honor today, PK Shah sir, is being throughout from this 2.5 hours. So I just want a last word from sir. Sir,
So before you say, I must thank my son. He was for 2.5 hours. I said, "ये किधर जाना नहीं चाहिए," because initially I was finding difficulties.
Definitely, sir.
And Dr. Jindal told me, so I was really worried. I caught him. I said, "You sit here."
What a master class conducted by 3 masters in a masterly way. What a way to spend Thursday evening learning about sex and sexual health. It could not have been possible but for these 3 experts. I think, Dr. Raj, we are very happy to see you and hear you. With all your examples that you gave, I think it made it very, very lively, and people will definitely remember, whosoever has heard you today evening. One thing I want to talk about Dr. Vijay Sarthi is that he said that you don't have to be an expert in sexology to help the couple with sexual problems. I really appreciate him. Anybody can manage, and it's not necessary that you have to be labeled a sexologist to help these couples with sexual problems. Dr. Sunil Jindal, I think you have really motivated a lot of gynecologists to start this clinic separately or along with obstetrician and gynecologist clinic. I think it is very important that today all those gynecologists who have joined us have really been given tremendous wealth of knowledge, because this particular subject is something which nobody wants to touch. But today we enjoyed each and every moment of it. Thank you so much, all the 3 speakers, and Dr. Neeraj and Dr. Apurva, for giving me this opportunity to be associated with this particular webinar. Thank you so much. And we would like to see you all in future again and again. Thank you.
Thanks,
Sir, should I start with vote of thanks?
Yes,
Please, go ahead.
So thank you so much. First of all, our dynamic president, Dr. Alpesh Gandhi sir, the vice president in charge, Dr. Ragini Agarwal ma'am, our secretary general, Dr. Jaideep Tang sir, and none other than our chairperson, the man behind all this program, our own Dr. Neeraj Yadav sir. Thanks to the ICOG chairperson, Dr. Mandakini Megh ma'am, and Parag Viniwale sir for giving us one credit point, one ICOG credit point for each session. Thank you so much to our guest of honor for today, Dr. PK Shah sir. Shah sir, thank you so much to being with us for whole 2.5 hours and give us blessing and your valuable suggestions. And none other than thank you so much our faculties for today, the Raj Sekhar sir, Dr. Sunil Jindal sir, and Dr. Vijay sir. They are always being there. So, and taking this such a difficult topic in such a smooth way, and definitely our concept is now very clear how to start our sexual medicine practice. Thank you so much, sir. And last but not the least, our technical team, and because this is the last series, and literally I am telling you, I am going to miss it like anything, because every fortnight we have this meeting. After one meeting, after every meeting, we are I called Neeraj sir, or Neeraj sir called me, अच्छा next का क्या करना है, next को कैसे करना है. Literally sir, मेरे को विश्वास नहीं हो रहा है कि we already finished this 6 sessions. But I think soon we will start some more session, because the response which we are getting is definitely tremendous. हमें उम्मीद नहीं था, है ना, but Sunil sir and Neeraj sir were always, भाई इतना hit जाएगा and लोग इसको लेंगे. We got emails of appreciation from all over the India, from breadth north to south, from Jammu. Doctor, I got it, because there is an email address where I and Neeraj sir are handling. We got email from Kerala to, from Jammu, from Northeast, from each and every part of India. It shows how important it is, and it also shows that people are really hungry to know about this sexual, sexual medicines, how to deal with that, how to deal with different problem, and how to start this, their clinic. So thank you so much for everyone, everybody, and to the audience for giving us so much love, so much affection, so much support. Thank you so much.
Thank you. Good night.
Thank you.
To the INTAS team also, for all the team, Lai and Mr. Satpati, who give the note to go ahead with this series. Without his support, this would have not been possible. So very big thank you